Any public comment? All right, seeing none, we'll move on to the COVID-19 plans, Old Baldy Golf Tournament.
So John Fuchs has provided a plan for the Old Baldy Golf Tournament. He gave it to us a couple weeks ago. I emailed it to you, and I think there were a few questions. I think the plan is pretty well thought out. John and I worked on it. Came up with, the times, of course, is not the golfing that we're always worried about. It's the before and after events. And John has come up with a good plan where people will remain in their carts, and they'll really emphasize staying in those carts while they're eating, when they're doing the Calcutta and those types of events. So I think that I don't see any reason they couldn't do it as long as they follow the guidance that they're doing there. And then, depending on where we are with masks, you'll just have to follow that guidance based on where we are. Like right now, you're fine because there's only, how many cases, Heather, officially here?
I have one positive and one probable.
Okay, so we're still fine right now. So, do you have any questions for me?
No, I have no questions.
And Leota, you're okay.
John, how are you? Johnny, do you have anything you wanted to add, or?
No, unless you guys have any questions, that's why we're here, is just to
Yeah.
fill in any blanks that might be there, but
Mhm.
we just need to know for a vote, obviously, to plan for the food costs and,
Yep, sure.
catering, and make sure we can do it, because we're getting asked every day by members and everything.
I would say that the Calcutta afterwards, traditionally less than half the players actually participate in that. Most teams, once they're done with their round, once they're done with their stake feed, they've already been out there, they've golfed, they leave. So we plan to do it out by the driving range, so we'll be able to spread out in our carts. John's got a microphone system so that we can make sure everybody's able to hear about how that goes. So I think that's the only thing I would add about Calcutta, is it's usually just not a very large number of people.
And when is this event?
August 14th, 15th, and 16th. Friday night, basically, Saturday day, Sunday day. And for the awards, the same thing. We would do the same thing for the awards. Have to be believed, like me knowing you didn't win anything. And then if you do, we would do the same thing, spread out in the carts and announce it. And one at a time, that person would be wearing a mask and would hand out the awards.
Do you limit the number of teams you have?
Yes, there's usually 36 teams, I think, is it?
Yeah, I would say typically we have anywhere from 28 to 32. This is
Okay.
kind of an unknown
Yeah.
year as to what the numbers might be. I would guess it's going to be
I think
maybe a little less,
72
but-
players max is what we usually do,
Yeah.
because that's the size of the course. You just can't have any more out there.
Okay. Anybody else have any other questions? Want to entertain a motion to approve the plan for the Old Baldy Golf Tournament?
Sure, I'll make that motion. I move, Mr. Chairman, that we approve the Old Baldy Golf Tournament plan.
I second.
Okay, motion's been made and seconded to approve the Old Baldy Golf Tournament plan. Is there any further discussion? All in favor?
Aye.
Aye.
Opposed, same. Motion carries. Okay, the High Winds Youth Rodeo. Thanks, Sean.
Thanks, John.
Thank you,
Thanks,
guys.
Zach.
Stay in touch with me on that as you get further
Yeah.
along with the food and all
Yeah,
that.
if anything else changes, we'll talk before.
Great, thank you. So we did receive a couple additional plans. One is in the works, so you have not received it. It's the High Winds Youth Rodeo, and they've done multiple rodeos in the state, and they're just need to get their document into a form that we can review. So and that is the 15th and 16th of August. So that'll be coming up. And then, as you know, you have the Silos public meeting #1. And I didn't write down the date for that. Do you guys remember the date?
August 1st,
So that's this Saturday.
yes.
And I've reviewed their plans and made a few comments, and they had sent those, I guess, to you, but I'll make sure that they get to all of the board.
Okay.
So sorry if I hadn't done that already. And I guess now is a good time to talk about the fact that I think that we can do the plans instead of having to have a meeting every week or every 2 weeks just to review COVID-19 plans. We will do them as an email out to the Board of Health. And then if the person or the group, the event wants to bring it to the Board of Health because they disagree or want more discussion, they can get on an agenda and we can have a meeting. But if it's something like the golf course one where we were all in agreement, we could move that forward without having to have the review
Okay.
or be on the agenda. So, and then I did have on here the mask enforcement and it says question mark, and that was just a question of what the board is going to want from my office and probably Heather's office, and then when we were under the mask directive, where we were supposed to go when we hear complaints and that. So not so much in that if let's say a restaurant doesn't enforce it on the public, that's a tricky one, and I understand because if they have a medical issue, they really can't ask that. However, if the restaurant itself refuses to put masks on, and that is part of the directive, I needed some guidance on that. We can table that until the future, or we can talk about it now. It's up to you guys, but it's something that I'll need some guidance potentially on in the future. So.
Well, we might as well discuss it now, so because it's gonna come back up again soon, I'm sure. So you're talking about if a business doesn't require their employees to put masks on and people are still frequenting the business, what leg does the Board of Health have to stand on?
And what direction do you want me to do? Am I just there to go try to educate them? Or do I?
I mean, that's the first part of the directive, is to educate people, right? I mean, that's what we want to try to do. I don't think anybody wants to try any type of enforcement action. As a matter of fact, I don't really think there's anything in the directive from enforcement that we have the ability to do, unless we were to pass if I remember this right, and that's the Board of Health passes a required mask requirement, then that would be something, but I guess it's not something I'm prepared to do right now.
No, I'm not either, really.
So,
I will forward, there's also some information from DPHHS about licensed establishments that they have to follow, because they have a license, they're under a different than some place that sells shoes or whatever, that's different, or Robbie selling, hardware. Because they have a food license, they have sent out some directives on that. But it still then comes down to us pursuing them with legal action through the county attorney. They're not going to do the legal action. So I'll forward that to you and we can think about that. So far, everyone has been very good to talk to and work with that I've had to deal with. So.
And the same here. I mean, if I just try to educate them and just kind of talk to them, and I haven't had any real big problems, so.
Thank you.
Leota, do you have anything, or?
Not as far as, we haven't really run into a whole lot in the hospital. We require of everybody, staff
Okay.
included. And we provide the masks right there at entrance if they need it, and we've not really had problems with it at all.
Okay.
The only thing that I saw in the directive that had to be done was a sign had to be posted in the door of the establishment on private property that says, that refers them to the mandate, and then there's a recommendation to have the mandate available. But the verbiage in the mandate uses the word you may enforce it, and the word may is being optional towards the landowner. And me and Sean were kind of discussing that too about food preparation. The Department of Health and Human Services has their own directive for food establishments and the preparation of and serving of food and the contacts. And I think that would be, in the event of that something is not being complied in that context, that I would recommend that's probably where that would be directed to, more so than our county attorney.
So does that make it as clear as mud to you, Sean?
No, it's exactly where I expect it to be. You know, I will do, if there becomes an issue where someone is, for whatever reason, belligerently in my face or something, I'll come to the board. But if I can educate and work with them, we'll do that. That's always the goal of our office, is to educate, not to mandate, so.
Very good.
I just think if we get too wrapped up in the enforcement side, we're going to lose our credibility as an approachable board.
Yeah.
Any other comments? Doc, you got anything?
No, I have nothing on that.
Okay. Okay, so we'll move on to our old business, public health officer. What do you
I've
got?
just been aware of the numbers that we have up and down. That's all that's been going on with me.
Okay,
And that's, for the most part, the public health concern now. I think I have to ask Nurse Heather about it, but I'm pretty sure the immunization clinic is going well too.
okay. Heather, what do you got? Anything?
Just been watching the numbers and working with the state, so.
Okay, so we'll go on the report from Board of Health members, approval of the minutes for July 10th. Is there a motion to approve the minutes for Friday, July 10th?
I'll make that motion.
Is there a second?
No, second to motion.
Motion been made and second to approve the minutes of July 10th. All in favor?
Aye.
Aye.
Opposed, same. Motion carries. Okay, county sanitarian, silos RV issues and the Bingham notice of violation.
All right, so as you know, we've been having some issues with folks creating what by the state's definition of an RV park at the silos area. The Department of Environmental Quality has issued some sort of letter to 17 landowners in the silos area. Just like Daryl emailed me, I clicked on the link and it's to access the DEQ server, which then there's a whole process. I will get that figured out. They just sent it on Friday, so I'm a little behind on that. But I will get that figured out so we know who they are, so that we can respond to people if they come in for sure, or have questions about that. So DEQ is taking the lead on that, which is great. It takes it out of our hands. So we'll just kind of follow and support them at this time. Last meeting, we talked about a well that was put in the wrong location for the Dakota Bingham. It's in the 2 subdivision, and I have written the notice of violation, and I'll forward that to you to review before we send it out. I do want to go out to the site one more time and just make a final measurement. It looks like it's 75 feet, but it's always good to have a physical measurement, so I will do that before we send out. And once again, the notice of violation will give the homeowners time to come up with a plan. It isn't our goal, of course, to just come down with a fist of fury on the folks. We'll try to work with them, but this is a pretty specific, and 100 feet is kind of the golden rule for a well, and there's data and information that actually shows that that's why we do it. But it is a state law, and both the well driller and the homeowner were aware that where the well should have been drilled. So we'll be issuing that. I think that's all I have for old business.
Sean, they can still they could use that well for irrigation, but they can't use it for drinking, or is there a restriction on that also?
Yeah, I think it's supposed to be, even irrigation wells are supposed to be from that, because effectively if the aquifer can get contaminated, it could contaminate the other well that's only 20 feet away. That whole aquifer could get contaminated because of that well. So
okay.
I believe it does have to be moved, but I'm sure it does. So there's other situations when a well can get put in where it can't be, like in a mixing zone and that type of thing, which is different than this 100-foot isolation zone. So.
Okay, thanks, Sean. Okay, new business. You got anything new, Doc?
No, sir.
That's it,
It's all right.
okay. Any other health board members have anything? Introduction of new board members. Leota Gormley. We'll get you a chair if you want to come up here and sit with us. And Dwight Thompson, I have letters here for you too. That's yours. Okay, report from Public Health Nurse Heather McMurdy, quarantine order for essential workers.
So last week I received a call from Eric, who works with the state and the DPHHS. So they had a business in Helena that was a doctor's office in Helena that was shut down due to a staff member that was positive for COVID-19. So that in turn, all of the staff were contacts. And so what they were asking me to do was to bring to you guys the order of quarantine due to the fact that between Jefferson County, Lewis and Clark County, and Broadwater County, there's a lot of people that live here that work in those different counties. And so they had the order of quarantine for essential workers. And so it's a quarantine where they could, as long as they don't have any signs and symptoms, they don't have a temperature, that they could go to work and then go right back home. And they have to still check in, they have to still check their temperature, they still have to do all that stuff, but they can go to work and then go home. So Drenda, who I work with the, she's the health officer for Lewis and Clark Public Health, she sent me this as a rough draft that we can go off of too. And so what they're asking is, and they're going off of what the CDC has recommended also for essential staff members for working that have no signs and symptoms. So anyway, I'm just here today to introduce this so that we can approve it or disapprove it for Broadwater County residents that work in Jefferson County and Lewis and Clark County and vice versa. So those three counties work together. So, that's what I'm here to let you guys, and Daryl, did you make copies of all this?
I didn't. I just
Okay, and-
printed it off and read it, so.
Okay, well, I can make copies and give them to whoever wants them. So that's what I have, for you guys today.
He's gonna copy it.
So, just let me know what we want to do, and, I can, get this typed up, and we can let the other two counties know that, yes, we're gonna participate, or no, we're not gonna go along with this.
Mhm.
So,
I guess I'm just sitting here thinking, could this work for us? What always comes to my mind is if we get an exposure in our courthouse, and the last thing we want to do is shut it down for a 14-day quarantine. Could we use something like this for that?
yes, we
instance?
could, as long as they don't have any signs and symptoms, and as long as, you know, they check in and they do everything that they're supposed to do, I don't see why we can't have an essential work, quarantine like that.
Okay, so I guess in our language, where it says essential health care, so if
We could change that.
Change that to,
We could, yeah, we can change it to however we want to word it. This is just a rough, this is what Lewis and Clark's using for their healthcare, essential healthcare workers.
right, and I guess I'm thinking when for you as well, I mean, that could work for your department.
That's kind of what we're doing right now.
Yes, yeah,
It's one of those that
yeah.
Yeah, what are you
we
gonna
can't
do?
close the
Yeah,
doors.
right, exactly, and your staff is pretty limited as well, and
Mhm.
so,
Yeah, because
Okay.
it could, yeah, I don't see why it can't work.
okay.
What do you think?
I think that's a good idea. I don't think why it can't work too.
Okay. So, that's what I have for that.
Okay.
So how many copies do I need to make for this, for the letter? So for,
I mean, after you, I guess I'm just speaking for myself, if you made a copy and just send it to us email-wise.
Okay.
We could all view it and make suggested
Sure.
corrections or whatever. And
okay,
then we'll come up with the final document. How's that sound?
sounds good to me. All right.
Okay, thanks, Heather.
You're welcome.
Public comment?
Thank you, Mr. Chair. Tim Ravenel, Redoubt News. On behalf of my viewers, readers, etc., the citizens of Broadwater County, I think I really have an essential question that a lot of people are going to be asking on this. This is the first I've seen this, so it's kind of like out of the box. I don't even personally be able to give you too much on it, but I think it's really important that the county is going to have, if you're going to go with this as an essential worker, what is your definition of an essential worker? Because if that's not well classed and defined, then we get into a situation, well, for example, under the directive, under Part 4D, for example, and again, I'm just trying to make sure that we're on the front page, media is an essential service. And so if we don't make sure that we do this right to be, if you will, in compliance with the order that is not law, we need to make sure that we don't infringe on the rights of other citizens as well as the First Amendment. And I could keep going, but I would like to leave it there and make sure that this board really takes a really close look at that and make sure that you don't get the bus out in front of the horse that's supposed to be in front pulling it. Thank you.
Did that document refer to the CDC as far as for what they considered essential people?
That's where they got it from, is
Yeah.
the
Mhm.
CDC.
Yeah.
Mhm. They're
Okay.
going by what the CDC recommends.
Mhm. Okay.
Excuse me, follow up, Mr. Chair?
Yes.
With that said, I think our last meeting here, there was a lot of discussion on the position of CDC and their recommendations and what positions that they are hoping to be able to help our local governments, et cetera, on through DPHHS and those directives that are coming from Governor Bullock. We need to make sure that we aren't basing something on that was maybe said last week, but no longer applies. Again, this is a moving target, and I know we need to be careful as citizens in this great state, but I really want to make sure that we need to make sure we don't have that repeat thing. Thank you.
Yeah, so this letter, this form actually says essential healthcare staff.
Right.
So do we want to have a letter for healthcare staff, and then we can have another policy for county?
Well, I think that's what we talked about. If we get the language right, it should be able to
Okay.
apply to where we need it.
Did they make a different one for the,
I'm sorry, what?
did they make a different one for law enforcement?
I only have healthcare. That's the only one. I could check into them and ask them.
I'd be curious.
Okay.
Okay, a report from the county sanitary. You got anything else, Sean?
Got just one last thing, and it's, we did receive the reopening plan from the schools, but that was just, we received it on Friday, and I haven't really had time to review that. And I think all they are asking from us is, some input. I don't know to what extent the Board of Health has or will want to take when it comes to the school plan itself, but we did just receive it, and so I'll make any recommendations, or I'll email them to you and to the superintendent. So.
Okay, thanks.
I guess, Sean, the one thing I see on this too, that there really isn't a plan if there's a case of exposure from students and what the school's position is. I mean, are they going to close it for 14 days? Because, I mean, a school is not, it could be argued essential, but, realistically, I mean, it's not an emergency service that's being, I guess that's part of the community. So I guess I'd like to see some language also regarding that scenario as well before we review it. That was just one of the glaring things that I saw.
So, I guess this is kind of for Heather. So would this order for quarantine, where are they putting? Are they putting teachers and administration as essential workers, or can they have the quarantine thing, or?
All of that, because I don't know about teachers right now, so.
Okay.
Yeah, I interpreted that when I read it initially, that it's referring to emergency personnel that is directly
that's
referred
what
to a hospital or the sheriff's
Essential
department.
health, yeah.
Right.
Mhm.
Okay. So I guess we kind of need to go through, each of us needs to go through this plan and offer up whatever comments we have, so we can get a solid plan in place for the school. I made just advice for them more than anything else. I would assume, are they, does the governor have a directive as far as what schools are doing? Or are they going through the MHSA, or?
There is a state directive of school reopening. I don't know if that came from it probably came from the state superintendent's office.
Are they leaving that to the district boards?
I'll have to look and see. I hadn't given it much thought because I didn't know I was gonna get this, actually, so, I'll have to look into that, so sorry.
Okay.
What I've heard is that it's up to the school boards and the superintendent to come up with plans and to see what they're gonna do and everything like that. That's the last I've heard.
That's pretty much what I've heard too. Okay. Yes, Tim?
Just a real quick question, is this draft idea of the school and the reopening, has that been advertised in the public? Because I haven't seen it in the paper or anything. And I know we're under a crunch, the school's gonna be opening pretty quick. A lot of parents are wondering what's going on there.
I was informed of a survey was sent out in regarding specifically the mask question, but I haven't seen the survey myself as far as what's on it.
And we just got this like 5 minutes before the meeting.
And this is draft.
So
And this is a draft. This is not ready for consideration
This is just a
yet.
draft, so.
Okay, well, I'll do my best to try to help you guys get it up so people so they know what's going on.
So is there any other reports or business to come in front of the board?
I have a question.
Yes.
In general, since we have so many medical experts here, I've heard everything. So if somebody tests positive for COVID-19, do they just wait, quarantine the 14 days, or do they have to be tested negative to get out of that? How does it work? There's a lot of confusion about it.
So we just got new directives on this last week. So if you test positive for a case, or if you test positive for COVID-19, excuse me, they are not doing the 2 negative tests anymore. It goes off of no fever for 24 hours without the aid of medication. So you cannot take Tylenol, Advil, anything like that to get rid of your temperature, your elevated temperature. And then it goes off improvement of signs and symptoms after 10 days of your day of exposure, or your day of whenever you come up positive. So that is the new recommendations that we're going off of.
Okay, thank you.
Mhm.
So do you have to test negative at all? You don't have to
No,
have
there's no more
test?
testing.
Okay.
That's been the confusion.
Yeah,
Mhm.
okay.
Yes, Tim?
Mr. Chair, where's those directives coming from?
I'm getting
The
them
latest.
from the DPHHS.
Thank you.
Do we want to set our regular meeting schedule again?
Yes.
So
We'll go back to the third
Wednesday?
Wednesday of every month at 1 o'clock will be our normal day.
So that'll be August 19th.
So our next meeting is August 19th, is that right?
Mhm.
One o'clock.
So if there's no other comments and no other business, we will adjourn the meeting. Anybody got anything?
No.
I'll entertain a motion to adjourn.
No?
One second before we do, I guess, are we sure we want to delay this to the 19th?
What?
Well, the
The-
plans, we talked about being able to go through email to.
Yeah,
Right.
we can email comments.
Okay,
and
gotcha.
do stuff like
If we need to
that,
hold
so.
a public hearing, we can do that as
Okay.
well. But we're just gonna try to do a monthly meeting unless we need to have a public hearing. And then those will have to meet the timeline requirements and everything.
I have a quick question. So if a group has an event and needs to get a plan approved, what is the process now?
You-
Send it to you?
Yeah.
Okay,
Yep.
first.
Yep.
Okay, thank you.
So is there a motion to adjourn?
I'll make a motion to adjourn.
Is there a second?
I'll second.
Motion's been made a second to adjourn. All in favor?
Aye.
Opposed, same. Motion carries.
Thank you, everybody.
Thanks, everyone.